The length of time is from 9 to 11. So let's help me welcome with big applause online crowd.
Thank you, Max. May I have permission to share screen? I'm seeing the.
Okay.
Okay. Okay.
Okay.
Good afternoon, everyone. I'm from Agora Speakers. I'm Kuan Yu. I'm a medical doctor, graduated in Malaysia 2011. I had an advanced diploma in internal medicine from UK, MRCP. And I have a family medicine diploma as well from Singapore. And I find that the Western medicine strength, right, is in three things. One is acute infections. Two, emergency situations like a heart attack, a stroke. And number three, situations when you need surgery. This is its strength. But I do find that there are areas that are missing. That's why I took up acupuncture as well. This is how I practice medicine and how I help other people. However, sometimes we get fringe clinical cases where it seems like nothing can really help. For example, number one is chronic pain in the neck and shoulders and lower back, and it's normal despite x-rays, or it's like you can do an MRI, just says that, oh, degenerative changes, but there's nothing really much you can do. A second common case I get will be person presenting with chest tightness, he's having palpitations, his heart rate is fast, and he appears breathless. When we do an ECG, when we do a chest x-ray, everything is fine, but he's not well. And another example would be someone with altered bowel habits. Having diarrhea some days, constipation other days, and then after a while, altered bowel habit is a red flag. So we'll send the person for a scope to make sure there's no polyps in the colon that could lead to cancer, and everything's fine. And for all these cases, right, we don't have very much to offer when all the tests come back normal. And especially for the pain case, right, initially we may give him Panadol, after that we'll escalate to perhaps an NSAID, after that we'll give something stronger, perhaps even something like morphine, but usually not for taking home. But after that, if nothing works, then we start that, perhaps you need some settling down. Come, take some sleeping pills. And after that, if that doesn't work, you need to calm down your system, take some tranquilizers. It's not something we like to do, but we don't have much to offer then. And what does the doctor say then? Everything's fine. Perhaps everything is in your head. So take a good rest, and try not to think too much. And that is what I prescribe as well, right? Try not to think too much until when I experience a turning point. So the question number 4 just now, right? My something serious illness. So in February last year, 1 week away from my birthday, I had an accident. And that accident, it was a freak accident involving my bicycle. And I fractured my radius and my ulna with my left hand. The scar is still there. And after the surgery, what was tormenting me was the pain. The pain in the middle of the night was 7 out of 10. And I managed only 2 hours of sleep every night for about a month. And during this time, I tried everything. I tried creams, essential oils, NSAID, a form of painkiller, sleeping pills, opioids, nerve modulators like gabapentin and Lyrica. Some of you may have come across that. I've tried everything. And I went back to the doctor again and again, my surgeon. And what does he say? He says that the implant is perfectly alright. So I have nothing to explain your symptoms. Perhaps everything is in your head. Try not to think too much. At this point, right, it's like, dang, this is what I used to tell my patients, man. And now I'm facing it. And what should and can I do about this? So it's like a wake me up moment, right? Indeed, a painful awakening. And the condition I had is called allodynia, where my peripheral nervous system is hyper primed, too primed, in fact, that even a stroke, a gentle brush of the blanket feels like fire. And that broke my sleep, right, every night after night. And when I couldn't sleep, the next best thing I could do is to meditate, a practice that I had for about 11-12 years now. And I keep thinking, why has this happened to me? And then finally I realized that my nervous system is not at rest. Something is still keeping it running. Is still is still hyper functioning. And why was it so? It's because as I was disabled after the accident, I was forced to slow down. A lot of things I couldn't do. I was worried about finances, I was worried about my family, I was worried about my work, and that kept me on edge. And when I realized that, right, I saw how we human beings are an integrated system, and our outer symptoms mirror our inner imbalance. And how do we see that? For example, you can imagine, right, when you are very anxious, you find yourself breathing very fast, you find your heart rate very fast, you may be sweating away. And some of us, when we are very, very stressed, just before going for a presentation, just before coming to Agora Speakers Talk, for example, some people may get, their stomach may disagree with them. They might go to the loo and they have cramps and everything. And some people, over prolonged periods of stress, some women may have experienced this. The periods may become spotty or they may stop altogether. And when this progresses long term, right, what happens is a combination of your nervous system, your hormonal system, and the next one that gets affected is your immune system. This is why people get shingles, why people get cold sores, is when their immunity is very, very low after a prolonged period of stress or a prolonged period of lack of sleep, for example. So the systemic dysregulation is the root of many symptoms that we see that Western medicine find hard to treat. And the underlying theme is called psychoneuroimmunology. And when I had this, right, I thought to myself, what could I do with this knowledge of what I experienced myself? Then I thought of like, what is the most painful condition in the world or in the world of medicine? And I just like you to imagine, right, your own experience. If you have a toothache, you can raise your hand, or you can put A in the chat. If you have experienced a headache before, I'd like you to raise your hand or put B in the chat. And if you have experienced either one of those, I'd like you to rate your pain from 1 to 10. Think about the number. On a score of 10 is something excruciating. 1 is perhaps, a slight bump. Okay, rate your own pain, and then we'll think about the worst pain ever, right? So there's something called a pain scale. It is arbitrary, but I like you to think that a tension headache, right, pain over the temples, we score it an 11. A severe toothache, those that keep you up, we give it a 19. Bone pain from cancer, imagine this scale as at a scale of 26. And if you amputate your digit, right, without anesthesia, we give it a point of 39. But this condition that I'm going to talk about is rated 46. I want you to imagine just how painful is that. And warning, because there are some unsettling photos, just like you to bear with me. So this condition, the limbs get swollen, they get discolored, and it's very, very painful when something brushes against the skin, or when there's a change in temperature going to rain, the pain increases twofold, threefold. Sometimes the entire limb becomes distorted in cramps, like on this photo where the foot is actually inverted. And because of this pain is so excruciating, they go through the whole gamut of pain medications that I went through myself. And beyond that, they scramble the nerves, they try to nerve dissection. And for some of them, they have run out of options. They fly over to Italy, the only country in the world where you can get this treatment, and they get an infusion, naridronate infusion, which costs 20,000 euros for 1 week's worth of medicines, and then the effect lasts about 2 to 3 months. So this is what they do. And for those people who can't afford this, what do? They actually, the pain, remember that digital amputation ranks below, right? Ranks below this condition. This condition is called CRPS. So what do? They actually amputate their limbs because they cannot bear with the pain. And some people call this a suicide disease because people take their own lives. And when I came across Nikki, she told me how this situation affected her, right? She couldn't work, she's in her 40s. She's bed-bound or chair-bound most of the days. When she's speaking to me, the pain is 10 out of 10. When something bumps against her leg accidentally, it goes up to 13 out of 10. And what is most painful for her is the fact that she has 2 autistic children. And because of her condition, she could not take care of them, and they have to take care of her. And she's just so affected by this. She's slightly depressed, I would say moderately depressed. And after undergoing what I did, right, I did some sessions with her. After 4 sessions, right, her pain went down by 40%. Her crying spells went down by 60%, so she no longer cried. Her swelling improved, and her dystonia, which is the curved ankle and cramps, went away, and she could walk without aids. And this is okay. And what is the most important to her? I just share this clip. Okay, I wonder whether there's sound.
They didn't mention anything yet, but I cooked a couple of times this week, and I have not done that in a month and a half.
In case there was no sound, I asked her, what did your family members notice about you? And she said that they didn't mention anything, but I haven't cooked for them for about 6 weeks, and this week I cooked 3 meals for them. And this was a functional improvement. And the most interesting thing is that you may ask me, like, what do you do to her? And like, I'm in Singapore, she's in Canada. So I had no needles, I had nothing. And what I did to her was understanding her, stabilizing her system, and I'm going to share what I actually did. Understanding the system is key. Psychobiology is therapy. The first thing I did was to stabilize her nervous system, let her calm down. Number 2 was I decoded what was actually happening inside, what was the trigger, and what was causing this disease that went on for 5 years, 7 years. People sometimes spend 10 years without finding out what is the diagnosis, because CRPS is something very hard to diagnose. And I decoded that she actually had very deep-seated trauma from her childhood and her young adulthood. So I released that. Finally, I managed to rewire her nervous system so that she no longer experienced the pain at that level. And I think that the root of many untreatable conditions actually lies in our psychobiology. And with this, I have helped people with chronic pain, panic disorders where nothing could help, and also in terminal sleep problems. And the side effect of this, I find that many people, after going through this process with me, they get improved function, their frozen shoulder goes away, they are happier, they are more energetic, they have better relationships because they are no longer so inside their own world, and they have better mental clarity, and also they are more confident. And my dream in 2026 is I already help people in 11 different countries with what I've discovered, and this year I hope to expand it to 24 countries. And who I can help the best? Number 1 is autoimmune and allergies, chronic unresolving pain, irritable bowel syndrome, depression, anxiety, phobias, panic disorders, burnout, lethargy, insomnia, brain fog, and perhaps I would love to help people with cancer. And who fits this mold? Someone who does everything right, tried almost everything, but nothing really works, and the tests are all normal. I like to help such a person, and I can't do this alone. I'm looking for collaborators worldwide, and I'm hoping to establish a community of people who understand their own psychoneuroimmunology. And I'm looking to help people in Japan, Indonesia, Vietnam, Brunei, and India. If you have anyone from these countries experiencing this, let me know. I'd like to help them out, even pro bono. Okay. And best among them will be the stressed out people, C-suites, and professionals. And yep, I have come to the end of my presentation. Thank you very much. I hope I did not overrun.
Okay, thank you so much. Thank you so much. So, who wants to evaluate Kuan's speech? Who wants? Anyone? Anyone who wants to volunteer? Oh, so Tsuchi, please. Tsuchi, you are muted.
Okay, thank you so much for your presentation, Kwan-san. I think I'm quite moved by your speech. In particular, you are using the materials, which helps me to understand what you're talking about. And your speech is very well organized. And I suppose you are primed for your presentation very well in advance. So I am so happy to hear your speech, because I have the same experiences. Actually, I'm now taking the regular clinic in Japan. Everything is fine with me, but I'm not so feel very well. I don't feel so well. And I always talk to my doctor, and he said, oh, you think too much. Don't worry too much. So finally, he sent me to the pain clinic. But I don't think it's a good idea, because I don't like to take a medicine or something like that, because I'm so much worried about the side effect. But probably, as you, based upon your presentation, I rethink about the integrated system and psychobiology and therapy. So those two keywords I learned today. So let me think about those, that brain always decide what I have to do, I think. So your presentation helps me a lot in the future. Thanks a lot.
Thank you, Susie.
Thank you. So, Bampe, you are also rising up
Yes,
your
yes.
Bampe, please.
Thank you. Dr. Young, I must say, just looking at your screen, already, before you speak, I already believe what you're going to say. No, because you look really good, yeah, really professional, and I think the image is important, and you projected the image that resonate very well with me, that this is a person I can trust, yeah. Now, then when you started, you reinforce the idea, because you said Western medicine is good for A, B, C, right? Which is true, right? Maybe surgery or acute whatever pain, they can deal with it very well. But there are limitations, certain things they cannot do. So I really like this presentation, because I feel you're very fair in your assessment, that what is credit worthy, you praise them, but which part they are not good, you share with us. I think you come across as a very fair, balanced person. You are not here to just push some idea to us. So that is very good. Now, thirdly, based on my background, I can relate with what you say. Of course, I'm not trained the way you are trained. I'm not able to express myself the way you are able to express yourself. So when I was young, growing up in a village in Malaysia, we don't have experts of your kind of training. What we do, we go to the temple, right? And the temple, that guy go into a trance and then chant and then give us a talisman. You go home, you burn it, you drink. But basically what he does is make us feel comfortable. They don't say they decode and they prescribe anything, but you feel, you know that because you believe that guy, the immune system, you will settle down, stop worrying. So I think I can relate to that. And also, I'm very glad that you specialize in this area, because I want you to treat my nephew. My son's brother is perfectly okay, but he is not okay, because maybe he got a stress, maybe he cannot sleep well. He get agitated, and then he lose self-control, that kind of behavioral kind of thing. He's a good boy. Now he's maybe about 30 or so. Perfectly healthy, perfectly strong, but I think there's something that need to be decoded and need to be managed. So I'm glad you are here, you presented. I wish we have recorded this. I would want him to watch the recording. Yeah, so later on, no, you're providing a service that the world needs. It's not that only you want to provide it, but somebody really need the service. So I think I must thank you for sharing this with us, and I will talk to my friends, if I can, to let them know there's this solution that you can provide. Thank you very much.
Thank you, Bang. I recorded myself so that I could improve, so I can share the recording with you.
Yes,
Okay.
please, yes.
Yeah, Cora, any other comments for your evaluation? Is that okay? Is that enough? Okay. All right. So let's move on to the reporting session. So, from the first is a grammarian report. Cassie, could you make a report of your grammarian role?
All right. Well, thank you, everyone. It's such a lovely and inspiring day for me. Of course, I get a lot of knowledge from you guys. Just a bit of note coming from me. I was blown away by the way that Ben Pang Ago kind of explored the words of thrive. I could just hear when he